Today's tip explains the guidelines for the use of documentation templates. According to CMS, physicians may use documentation templates as long as they're individualized for each patient's needs and experiences. So here's a few important guidelines provided by WPS and Medicare that you should be aware of. Ancillary staff, MAs, or the patient may complete the following as part of the template: the checklist and/or the medical record, the history of present illness, review of systems, past family and social history, but the provider then must indicate that the information has been reviewed with the patient. Providers may use a review of systems or past family social history from a previous encounter. However, the provider must review all the elements of the previous encounter and notate any changes. In order to support the level of service, all documentation should clearly define the examination and the findings indicated in the patient's record. Negative and normal are actually sufficient terms to document your findings, but the provider must document any specific or pertinent information about the abnormal or negative findings of symptomatic body areas or organ systems. Keep in mind, simply stating abnormal without any elaboration would be considered insufficient documentation. Finally, providers should be wary of templates that have pre-printed information that would indicate a comprehensive level of service was performed. Remember, it is okay to use the templates as a checklist to ensure that you cover everything that you need to in a visit, but the information should be specific to that patient for that date of service. Failure to document the date of service individually could put a patient at risk for harm and raise red flags for auditors. So make sure to completely document each patient visit thoroughly. Put yourself in an auditor's shoes. If you read your notes and they all look exactly the same or have very consistent similarities in messaging, you might have a problem. As always, say what you see. I'm Dr. Amy Capuccia, and this has been your MRA Tip of the Day.